And that's why I can't stay silent about this anymore. I have patients coming into my office at 65, 70 years old, completely lucid just 2 years ago, and now they can't even remember their own grandchildren's names. And you know what they all have in common? They've all been taking the same type of medication for years.
Wait, are you telling me there's a type of medication causing dementia in people? Medications prescribed by doctors?
Not just causing, accelerating it. And the worst part is, most doctors don't even know this, or they know and don't tell their patients. We're talking about medications that millions of Americans take every single day, thinking they're taking care of their health, when in reality, they're slowly destroying their brains.
Oh my God, that's terrifying. And you're sure about this?
I'm more than sure. I have the research, I have the clinical cases, and I have a guilty conscience for prescribing some of these medications for years without fully knowing the neurological risks. Today, I'm going to talk about this, even knowing I might be criticized by the medical community.
Doctor, what you're saying is very serious. You're basically saying there's a silent epidemic happening right under our noses?
That's exactly what I'm saying, a silent epidemic. And what makes me even more upset is that when these people show up with dementia symptoms, doctors immediately prescribe even stronger medications to treat the dementia, without even considering that the meds they're already taking might be the root cause.
Doctor, you've just made a very serious statement. Are you saying there are common medications causing memory problems in elderly people?
Exactly. And when I say common, I mean medications that are in practically every American household pharmacy. Blood pressure meds, allergy meds, reflux meds, sleep aids, medications patients take religiously, thinking they're protecting their health. But how is that possible? How can FDA-approved medications be causing dementia? That's a question that's been bothering me for years. The problem is, when these medications were approved, long-term studies on neurological effects simply didn't exist. No one followed these people for 10, 15, 20 years to see what was happening to their brains. And now, we're seeing the consequences.
What consequences are you seeing in your office?
Let me give you a real example, without naming names, of course. Last week, a 68-year-old woman came into my office. She was taking 3 different medications, one for high blood pressure, one for reflux, and another for seasonal allergies, all from the same family of drugs I'm about to explain. She started complaining about forgetfulness about 2 years ago. At first it was small things, where she left her keys, the name of that actress from a movie. But in recent months, she started getting lost while driving in places she's known for decades. That's awful. And you think it was the medications? I don't think. I'm sure. Because when I reviewed her history, I found out she started taking these medications exactly 3 years before the first symptoms appeared. And she's not an isolated case. I'm seeing this over and over again. In fact, in the past 2 years, I've documented over 40 similar cases in my practice. 40 cases! That's a lot for just one office. What pattern are you seeing? The pattern is always the same. People between 55 and 75 years old who start taking these medications for seemingly minor issues, a seasonal allergy, mild reflux, trouble sleeping, and 2 or 3 years later, the first signs of cognitive decline appear. First, it's short-term memory. They forget where they put things, miss appointments, repeat the same stories over and over again.
And then it gets worse.
It progressively worsens. They start having trouble finding words, following simple instructions, doing basic math they've done all their lives. Many begin showing personality changes, too. They get more irritable, more confused, more anxious.
But what kind of medication is this? Can you be specific?
Yes, and I will, because people need to know. We're mainly talking about anticholinergic medications. That name might sound complicated, but these are very common drugs. They include certain antihistamines, like Benadryl, medications for overactive bladder, some tricyclic antidepressants, motion sickness drugs, and even some Parkinson's medications. Benadryl. But that's sold over the counter. Everybody takes Benadryl. Exactly, and that's the problem. People take it thinking it's harmless because it doesn't require a prescription. But did you know that taking Benadryl regularly can have the same effect on the brain as natural aging, only faster? There are people taking Benadryl every night for years to help them sleep, not realizing they're literally shrinking their own brains. Shrinking the brain, is that even possible? Unfortunately, yes. There's a study published in JAMA Neurology that did MRI scans on people who had been taking these medications long-term. The results were shocking. They had less gray matter in the brain, especially in areas responsible for memory and learning. The brain was literally smaller. What do you mean? Explain that better. These medications block a chemical in the brain called acetylcholine. This substance is essential for memory and learning. It's like the fuel that helps neurons communicate with each other. When you chronically block it, you're literally preventing your brain from functioning the way it should. It's like shutting down the communication system between neurons.
And do doctors know this?
Some do, some don't. But what bothers me is that even those who know continue prescribing these medications without warning patients about the neurological risks. They mention the common side effects, dry mouth, drowsiness, dizziness, but they don't mention that prolonged use can cause dementia. It's like this information is a well-kept secret. That's outrageous. Why don't they talk about it? Because often they don't know what to substitute. It's easier to keep the patient on the same medication than to search for alternatives. And also because many doctors still don't believe this connection exists. They treat dementia symptoms as something entirely separate from the medications the patient is already taking. It's a dangerous professional blindness.
Do you think there's resistance from the medical community to accept this?
Absolutely. Imagine the implication of what I'm saying. If it's true that these medications are causing mass dementia, it means a significant part of the Alzheimer's epidemic we're seeing could be iatrogenic, that is, caused by medical treatments themselves. That's a very hard thing to accept for anyone working in the field. But are there studies on this? There are, and they're scary. There's a study from the University of Washington that followed more than 3,000 people for 7 years. They found that people who took anticholinergic medications for more than 3 years had a 54% higher chance of developing dementia. 54%. That's no coincidence. And there's another study from Indiana University that showed that people taking just 2 of these medications simultaneously had an even higher risk.
And why aren't these studies more widely publicized?
Because it's inconvenient. Imagine the economic impact if people suddenly stopped taking these medications overnight. We're talking about billions of dollars in annual sales. Pharmaceutical companies have no interest in promoting studies that show their products might cause dementia.
There's another study, published in the British Medical Journal, that showed people over 55 who were taking these medications had physically smaller brains. Smaller. They did MRI scans and compared them with people who weren't taking these meds. The difference was visible in the images.
And the scariest part is that this brain shrinkage happens gradually and silently. The person doesn't feel anything in the first months or even years. They keep taking the medication, thinking they're taking care of themselves, while their brain slowly deteriorates.
What other medications are on this list?
Look, I'm going to be very specific because people need to know. Sleep aids like Tylenol PM, Advil PM, Unisom, they all contain diphenhydramine, which is a potent anticholinergic. Reflux medications like some H2 blockers, ranitidine, which luckily was pulled from the market, but cimetidine is still available. Overactive bladder meds like Detrol, Ditropan, Vesicare, some antidepressants like amitriptyline and nortriptyline, and motion sickness meds like Dramamine.
And what's even more concerning is that many people take several of these at the same time, right?
Exactly. This is what I call the toxic cascade effect. A person takes a blood pressure med that has anticholinergic effects, another for sleep that also does, another for allergies that does too, and sometimes even a fourth one for reflux. The effect is cumulative and multiplicative. It's like you're taking a quadruple dose of brain poison every day.
Brain poison. That's a pretty direct way to put it.
I use that expression because that's exactly what they are for the brain, long term. And the worst part is the effects are silent and, in many cases, irreversible. You don't feel anything in the first few years, the brain just slowly deteriorates, and when the symptoms show up, it's often too late to fully reverse the damage.
Do you have more concrete examples from your patients?
I have several. Another case that really stood out to me was a 64-year-old retired executive, very intelligent, who started taking Benadryl every night because of seasonal allergies and insomnia. After 2 years, his wife started noticing he was repeating the same stories, missing important appointments, having trouble using the computer he had used for decades.
And what happened when he stopped?
When I suggested he gradually stop taking Benadryl and look for alternatives for both his allergies and his sleep issues, the improvement was remarkable, but not complete. In 6 months, he regained part of his memory and concentration abilities, but some functions never fully returned. That showed me that the earlier we identify the problem, the better the prognosis.
So you're saying that when someone starts having memory problems, the damage may already be established?
In many cases, yes. The brain has an incredible capacity to recover, especially if we stop the chemical assault early. But the longer someone stays exposed to these medications, the harder recovery becomes. It's like a bank account. You might be making withdrawals, neurons, every day without realizing it, and when you finally check the balance, you find out you're deep in the red.
That's terrifying. How can people protect themselves?
First, awareness. People need to know these medications exist and that they can be dangerous. Second, they need to be proactive with their doctors. They can't just accept a prescription without asking questions. Third, they need to pay attention to the first signs of cognitive decline and not just accept it as normal aging.
What specific signs should people watch out for?
Recent memory problems that didn't exist before, forgetting where you left your keys more often than usual, forgetting names of people you know well, asking the same question repeatedly, difficulty finding words you've always known, confusion in situations that used to be automatic, like doing simple math or following familiar recipes, unexplained mood changes, irritability, anxiety, depression that wasn't there before.
And what would you say to someone listening right now who recognizes some of these symptoms?
I'd say don't panic, but also don't ignore the signs. The first step is to make a complete list of all the medications you're taking, including over-the-counter drugs and supplements, everything. Then, research which ones have anticholinergic effects. There's a scale called the Anticholinergic Cognitive Burden Scale that ranks medications based on their risk.
How does this scale work?
The scale goes from 0 to 3. Medications with a score of 0 have no anticholinergic effect. Score 1 means minimal effect. Score 2 is moderate, and score 3 is severe. The problem is that most people are taking several medications with a score of 2 or 3 at the same time, which multiplies the risk.
And what would be a safe score?
Ideally, 0. But if that's not possible, as low as possible. Studies show that people with a total score above 3 already start having an increased risk of cognitive decline. Imagine people coming into my office with scores of 8, 10, 12. It's like they're on a downhill neurological roller coaster.
And do doctors know about this scale?
Some do, but most don't use it in clinical practice. And that's the problem. They prescribe medications individually without calculating the cumulative effect. It's like each specialist is treating one part of the body without talking to the others.
What kind of alternatives exist for these medications?
It depends on the medication and the condition. For allergies, for example, there are nasal corticosteroid sprays that are much safer than oral antihistamines. Medications like Flonase or Nasacort don't cross the blood-brain barrier, so they don't affect the brain. For reflux, dietary changes, raising the head of the bed, and lower doses of proton pump inhibitors can be alternatives. For insomnia, sleep hygiene techniques, melatonin, and sometimes cognitive behavioral therapy are much more effective long-term.
And for high blood pressure?
For high blood pressure, there are several classes of brain-safe medications. ACE inhibitors, ARBs, angiotensin receptor blockers, calcium channel blockers, and even some diuretics are much safer alternatives. The problem is that some doctors still prescribe older medications with anticholinergic effects out of habit or lack of updated knowledge.
Do you think elderly people are more vulnerable to these effects?
Absolutely. As we age, our brains naturally produce less acetylcholine. The blood-brain barrier also becomes more permeable, allowing more medications to pass into the brain. Metabolism slows down, so drugs stay in the body longer, and the aging brain has less functional reserve to compensate for the damage. It's a perfect storm.
And is there any way to reverse the damage?
Partially, yes. As I said, the brain has the capacity for neuroplasticity even at older ages, but it's crucial to stop exposure to problematic medications as soon as possible. The longer someone stays exposed, the harder recovery becomes, and some losses may be permanent.
What else can people do to protect their brains?
Besides reviewing medications, regular physical exercise is essential. It improves cerebral circulation and stimulates the production of neuronal growth factors, a diet rich in antioxidants and omega-3s, constant cognitive stimulation, reading, games, learning new things, managing other risk factors like diabetes, non-medication controlled hypertension and obesity, and quality sleep, which is when the brain performs its daily cleaning of accumulated toxins.
What would you say to a family who's seeing a loved one with memory problems? First, don't accept that memory problems are normal for their age. Significant cognitive decline is not a normal part of aging. Second, do a full audit of all the medications the person is taking. Third, find a doctor who's willing to review all the medications and look for safer alternatives. And don't be afraid to ask questions, seek second opinions, and be persistent.
How can families have this conversation with doctors who might resist making changes?
Bring concrete information. Print out the studies I mentioned. Ask specific questions. Doctor, does this medication have anticholinergic effects? What's its score on the cognitive risk scale? Are there safer alternatives for the brain? If the doctor can't answer or isn't willing to investigate, find another professional.
Is this something that should be discussed more openly in medicine?
Definitely. I believe there's an ethical responsibility to inform patients about all risks, including long-term neurological ones. People have the right to know that the medication they're taking might affect their memory and their ability to think. It's a matter of true informed consent.
And why do you think this isn't being discussed?
Because it touches on powerful interests. It affects the pharmaceutical industry, it challenges medical protocols that have been in place for decades, and it disrupts the way medicine is practiced. It's easier to maintain the status quo than to admit we've been making systemic mistakes for years. And admitting it would mean taking on huge responsibility.
What kind of responsibility?
The responsibility of reviewing millions of prescriptions, retraining doctors, developing new protocols, facing possible lawsuits. It's much easier to keep prescribing the way it's always been done than to revolutionize medical practice. But the cost is being paid by patients in the form of early dementia and loss of quality of life.
Do you think there's an epidemic of iatrogenic dementia?
I believe a significant portion of what we're seeing as the Alzheimer's epidemic could have a medication-related origin. I'm not saying all dementia cases are caused by medications, but I am saying a considerable percentage could be, and that's something we urgently need to investigate.
What would that investigation look like? It would require long-term prospective studies, following people taking these medications for decades. Withdrawal studies would also be important, seeing what happens when people stop taking these meds. And most importantly, it would be essential to create clinical guidelines that factor in cognitive risk when prescribing any medication.
And while that doesn't happen, what can people do?
Be their own advocates. Don't wait for the medical system to change on its own. Be proactive, ask questions, demand answers. Research your medications, understand the risks, look for alternatives. And most of all, don't accept cognitive decline as something inevitable.
Doctor, this conversation has been both eye-opening and terrifying at the same time. What would you like to leave as your final message for those listening?
Look, I want people to understand that this is not some conspiracy theory. This is solid science based on peer-reviewed studies published in the world's leading medical journals. There's clear evidence showing that certain medications can accelerate cognitive decline, and people have an absolute right to know that.
And what can they do immediately?
5 fundamental things they can do today. First, do a complete audit of all the medications you're taking, including over-the-counter drugs and supplements. Second, research whether any of them have anticholinergic effects. There's information available online. Third, calculate the total cognitive risk score of your medications. Fourth, schedule an appointment with your doctors to discuss safer alternatives. And fifth, don't accept it's normal for your age as an answer to memory problems.
And if the doctor won't listen or cooperate?
Then find another doctor. You have the right to a professional who takes your concerns seriously and stays updated with the latest research. Your memory and your ability to think are far too precious to be put at risk by unnecessary medications or ones that could be replaced with safer alternatives. Don't be afraid to be persistent or to seek second, third opinions.
Is there any website or resource where people can check their medications?
Yes, there are several online tools. The American Geriatric Society website has lists of potentially inappropriate medications for older adults. There are also online calculators for the anticholinergic burden scale. And always read the full medication leaflets, not just the common side effects, but look for warnings about neurological or cognitive effects.
And for those already experiencing memory problems?
For those people, the urgency is even greater. Don't wait for symptoms to get worse. Seek medical evaluation immediately, but bring the complete list of medications. Insist that a correlation between the meds and the symptoms be investigated. And don't accept a dementia diagnosis without first attempting a gradual withdrawal of the suspected medications, obviously under medical supervision.
Doctor, thank you so much for having the courage to talk about this. I know it's not easy to go against what's established in medicine.
It's my moral and professional obligation. I swore to protect my patients' health, and that includes protecting them from medications that might be doing more harm than good. If I can help even one person preserve their memory and independence for longer, then any criticism I get from the medical community will have been worth it.
And for those listening and worried about their own memory or loved ones, what's your message of hope?
My message is don't give up. Don't accept that memory problems are inevitable with age. Science is on your side. There are safer alternatives for practically every problematic medication. Investigate, question, seek alternatives. Be persistent. Many times the solution is simpler than you think. It could just be a matter of switching to a safer medication or realizing a medication isn't even necessary anymore.
And what's your final piece of advice for families?
Don't underestimate the power you have as advocates for your own health. The medical system won't change automatically. You need to be the agents of change.
Ask questions, demand answers, seek information, challenge authorities. Always remember, you know your body and mind better than any doctor who sees you for 15 minutes every 6 months.
That's a powerful message of empowerment and also an urgent warning. Folks, take this information very seriously. Talk to your families, review your medications, question your doctors, and protect your brain health as the most precious asset you have.
Exactly. And remember, every day you spend taking a potentially neurotoxic medication is one less day of optimal brain function. Don't wait until tomorrow to do what you can do today. Your future quality of life, your independence, your ability to recognize your loved ones, all of that may depend on the decisions you make today about your medications.
Doctor, thank you so much for this brave and eye-opening conversation. And to everyone listening, don't let this information go to waste. Share it with family and friends. Your brain health could be at silent risk, and now you have the knowledge and the power to do something about it.
Thank you for giving me this platform to speak the truth. If this conversation can save even one person's memory, if it can prevent even one family from going through the heartbreak of watching a loved one lose their identity because of unnecessary medications, then any controversy this might cause will have been worth it. The truth needs to be told, even when it makes powerful people uncomfortable.